In today's episode, we are going over an evidence-based guide to physical therapy rehabilitation after arthroscopic rotator cuff repair surgery. Let's do it. All right, so what's the problem with rotator cuff repair surgery? Well, first and foremost, rotator cuff related pain is the number one most common type of shoulder pain reported in the medical literature. It is extremely common, and therefore the repair is actually common as well. One of the issues with rotator cuff repairs is that they will often re-tear, and the rates are highly dependent on the type of tear. However, in some studies, they're as high as 94%, right? So essentially, almost 100% of all rotator cuff tears in some studies will re-tear over the course of time, right? And this is not common for the majority of rotator cuff repairs, obviously, but it does end up getting a little alarming from a physical therapy standpoint because we actually do know that what we choose from a physical therapy perspective to do with our patients will influence their outcomes and also influences whether or not they re-tear over the course of time, right? So if I go too fast, am I going to cause a re-tear? If I'm not going fast enough, will I not facilitate healing, right? What should a physical therapist do? The other piece that becomes very, very confusing is that there's a huge variance in different protocols in patients that have rotator cuff repair surgery. You may have one patient that comes in and the physician has no sling on the patient and active range of motion starts at, let's say, 4 weeks. And you might have another patient that comes in at week 10 and they were in a sling for 6 weeks and they're not allowed to do any sort of strengthening until they get to month 3 or month 4 even, right? So there's huge variance between different protocols. And the other piece is that the medical literature is relatively clear in the sense that some tears can potentially be pushed a little faster than others. So it's not just like every single rotator cuff tear repair should be treated the same, right? And the thing is, as physical therapists, we want to try to optimize our outcomes. We want to minimize the risk of re-tears. So how the heck should we go about this? What should physical therapy rehabilitation look like? And what should be those differences from patient A to patient B with different size tears, different occupations, going back to different sports, et cetera, et cetera. So in today's episode, we're going to go over outcomes following rotator cuff repair surgery. Does the surgery work well? Are patients happy, satisfied? Do they get back to their sport after they finish up getting the repair surgery? Should you immobilize and put a sling on the shoulder following rotator cuff repair? When should you initiate range of motion exercises? And this goes for passive range of motion as well as active range of motion. Is there a difference between accelerated physical therapy program and more standard or conservative programs? What are factors that are going to influence the rate of progression and also healing rates? And lastly, what are return to sport times and rates? Are people returning back to sport? Are they getting back to the same level as did before? Is there a difference between different types of sports, right? And lastly, how about barbell athletes? So the folks that we love working with, as physical therapists that really enjoy strength and fitness. Now, before we really get going, I want to let you know about a free resource. I have made a rotator cuff tendinopathy and rotator cuff tear evidence-based cheat sheet for you to check out. It's 100% free. I'll put a link in the show notes. You can check it out. We go over rotator cuff tear prevalence, anatomy, the difference between a tendinitis and tendinosis. We go over risk factors for tears and tendinopathy. We go over the clinical presentation, common tear types, rehab expectations, as well as surgical candidates. So who is the best candidate for rotator cuff repair surgery? Because not all folks are going to need surgery. So we'll go over all of that in this cheat sheet. I'll leave a link in the show notes, 100% free. Go grab it. And welcome to the Fitness Pain Free Show. This is where we help coaches and physical therapists like yourself get your patients out of pain and back in the gym where they belong. My name is Dan Pope. I'm a physical therapist. I'm a coach, personal trainer, and a meathead. I love all things fitness. I have my dream job as a physical therapist, coach, business owner, and educator, and I've been doing it for a few decades now. My goal is to help you reach your goals so you can be as happy as I am. Now, I want to put a little standard disclaimer in the mix here. If you are an individual that just had rotator cuff repair, this is in no ways a guide to your rehabilitation, all right? You definitely want to try to get guidance from a physical therapist or surgeon. Do not take my advice. Do not go ahead and just do everything that I talk about here today. I think it's very important that I state that. The second piece is that I am not going to include a protocol here. This is not going to say week 2, start this, week 4, start this. I'm really kind of summarizing the evidence and just helping you to critically reason as a physical therapist or coach to try to figure out what's best for your patient, right? If you want some really good in-depth information on how to treat rotator cuff repairs, I highly recommend you checking out anything from Kevin Wilk. I call him the rotator cuff repair master. He has a ton of great courses out there, lots of good free information as well. Go into Google, throw in his name next to rotator cuff. You'll find all sorts of great stuff. And lastly, if you do want a decent protocol, I find myself recommending the protocols over in the University of Delaware quite a bit. And I'll leave those protocols as a link in the show notes if you want to check that out. They have a bunch of really good protocols for rotator cuff repair. This is part 3. If you haven't checked out part 1 or part 2, I recommend checking it out now. Head over to the show notes. I'll leave a link there, and then you get back to this one. All right, let's get rolling. What factors affect rotator cuff repair healing after surgery? So essentially, after you have rotator cuff repair, you have some sutures that are going to attach the tendon back down to the bone. So the concern here is that over the course of time, this tendon might re-tear back off, or maybe the tendon just doesn't heal back down to the bone. So there are a variety of factors that are going to influence whether or not that tendon heals back down to the bone. And we know those. So we have some medical research to show this. So one, your age is going to influence this. The older you are, the less likely you are to heal well. That makes sense. The surgical technique is also going to affect this. So if you have a single row procedure, it might not be as strong as a double row procedure. We have some research to support this. So the double row repair has been shown to have better biomechanical strength, footprint coverage, and radiographic healing rates. Next, if you have diabetes, less likely to heal quite as well. If you're a smoker, you're less likely to heal as well. If you're trying to get back to manual labor over the course of time, you're more likely to re-tear. Makes sense. Basically, that rotator cuff is going to be asked to be doing more over the course of time than someone that's more sedentary, or at least doesn't do a bunch of manual overhead activities. The size of the tear is going to greatly affect the risk of re-tear. So a small tear, low risk of re-tear. If you have a massive retracted tear, much higher risk of re-tear over the course of time. Tendon quality is also very important. So like I said, did the tendon retract? That's important. Fatty infiltrate is going to be another thing that's going to affect the healing rates. So essentially, after you have a full thickness rotator cuff tear, the tendon tears off of the bone, the muscle that attaches to that tendon starts to become filled with fat, and then you'll get some atrophy of the muscle itself. So if there's a bunch of fatty infiltrate into the muscle with atrophy, then the likelihood of this healing over the course of time after repair just goes down. So this brings us to our next point, and this is probably the biggest takeaway with this entire Fitness Pain Free show. Essentially, you should use your brain when you're trying to figure out how fast or how slow you should go with your rotator cuff repair patients, right? So there's a variety of factors that we know that can influence your healing rates, your re-tear rates, et cetera. And there's a variety of different things we know that are going to be helpful to help you heal a little bit faster, right? So essentially, we can speed things up or slow things down based on these variables, okay? So what are some of the variables that, when they're present, we have to think about slowing down our rehabilitation after rotator cuff repair? So one, age. Older folks don't heal quite as fast, so we probably have to go slower. If you have a single row repair, doesn't necessarily attach the tendon down as well as a double row, so we may have to go a little slower and wait a little longer for that tendon to heal down to the bone. If you have a history of diabetes, or if you're a smoker, just not going to heal as well, okay? So probably it's going to take a little bit longer. If you're trying to get back to manual labor, and I would also lump athletes into this as well, we probably have to delay our rehabilitation a little bit. And this is simply because we're going to be throwing a lot more stress at the shoulder if you are in manual labor returning to work, or you're an overhead athlete like a baseball player returning back to pitching, right? So we need a little more time to establish some more strength in that area, okay? The next piece is the size of the tear. So if you have either a large or a massive tear, so massive tears are going to affect multiple tendons and just a bigger tear in general. There's also more likelihood of that being a retracted tear, right? Also, there's more likelihood of there being more fatty infiltrate and muscle atrophy. If any of these things are present, we probably need to slow down our rehabilitation. Now, if we have a lot of these things present, so let's say I have an older individual, single row repair, they have diabetes, they smoke, they're trying to get back to manual labor, plus they have a massive tear, multiple tendons involved, a whole bunch of fatty infiltrate, I need to go dang slow with this individual because the risk of re-tear is very high, and I'm trying to do everything in my power to make sure that we have a successful outcome, right? But if I only have, let's say, one or two of these things present, maybe I don't go quite as slow, right? I can speed it up just a touch. So, what are some of the factors that, when present, kind of pushes us to this idea of an accelerated rehab protocol or just a faster onset of passive range of motion and/or getting the sling off a little bit faster? Well, for one, younger age. If you have a young buck in front of you, chances are they're going to heal pretty well. The re-tear rates are going to be a little bit lower. Okay. Next piece is a double row repair. We know those are a bit stronger, so maybe we're able to be a little more aggressive in the earlier stages of rehab. If someone is a non-manual laborer or an athlete, let's say you have a young student that just wants to get back to life and they don't care about getting back to any sort of manual labor at all, any sport, we could probably go a little faster with these folks simply because we're not going to be putting a ton of stress on that cuff because they're not going back to tough things with the shoulder. If you have an individual with a small to a medium tear, chances are they have less likelihood of re-tear if we go a little bit more accelerated, right? If this individual has a partial thickness tear, same thing. We're less concerned about a re-tear, and we may actually improve their range of motion earlier on and have less stiffness and pain after the surgery, which is definitely a good thing. And the last thing that we're looking for to try to accelerate folks is going to be tissue quality. So if someone doesn't have any fatty infiltrate, there's no atrophy, there's no retraction of the tendon, that's all a good sign. Healthy tendon, probably going to heal back on really well to the bone. We can probably utilize more of an accelerated approach with these folks. So, guys, if you like what you're learning about so far, then I want you to go and check out the Fitness Pain Free Mini Course. So, I made a mini course. It's absolutely free. That's the next logical step if you want to learn more from me. So, in the course, we go over 5 lessons. That first lesson is how traditional schooling has failed us, right? So, schooling is phenomenal from a physical therapy perspective, but doesn't really teach you how to work with high level athletes in the fitness world, right? Doesn't always teach you how to do the lifts appropriately. Doesn't teach you about progressions and regressions of common lifts within the gym. Doesn't teach you how to program normally, how to write rehab programs, or how to write injury prevention programs for these folks. Next thing we go over, 7 reasons why people get hurt in the gym, 4 simple steps to getting your clients out of pain, how to build the career of your dreams and earn the respect of your community. It's all well and good if you know exactly how to work with folks within the gym. But if you can't get these folks through the door on a regular basis, then you're simply not going to be living the dream that you want to because you can't get the patients through the door that you want to work with. Okay. So I'll show you how to do that. And lastly, we'll talk a little bit about the Fitness Pain Free certification, right? So I'll leave a link in the show notes. I definitely recommend checking this out. Once you sign up for the Fitness Pain Free Mini Course, you will be automatically placed in the waitlist for the Fitness Pain Free certification. Now, the Fitness Pain Free certification is the course, the certification that I wish I had as a new grad that fills in all the gaps in knowledge that you don't get in physical therapy school. So, A, you'll gain complete confidence working with injuries in the strength and fitness world. You'll learn optimal technique for both health and performance from myself and some of the best coaches in the world. You'll master programming for rehabilitation and injury prevention. Have fun while earning a whole bunch of physical therapy and physical therapy assistant credits. You have 31.5 of those. You'll also gain NSCA credits as well as CrossFit credits if you need those. This is the equivalent of a university education in working with injuries in the weight room. I really believe that. I've been adding to this thing over the past 5 or 6 years. It's massive, a ton of phenomenal information. And lastly, the biggest goal is just to fill your day with the patients you love working with and building the respect and admiration of the communities you love working with. So I'll leave a link in the show notes. Sign up for the Fitness Pain Free Mini Course. The certification is open 4 times per year for 1 week to enroll into. If you're on the wait list by signing up for the Fitness Pain Free Mini Course, I'll alert you when that next enrollment period is open and you can get started. Let's get back to the show now. So now that we've established that not all tears should be created equally, how do we go about actually getting this information? Because largely when someone comes through the door in the physical therapy clinic, chances are, they're not going to have all this information on them, right? A lot of folks don't even know what type of surgery they've had, right? Let alone what their tissue quality was like prior to surgery. So I think it's very, very important that you communicate with the surgeon so you get an idea of what the repair was like, right? So what kind of questions can you ask the surgeon so you can have a better outcome with your patient, right? So first and foremost, you ask, what type of repair was this? Okay. Was this a rotator cuff repair? Was this a labral repair? I mean, it usually comes with a PT script, but every once in a while you don't have a PT script or you can't read the PT script, right? Or the patient can't remember what the surgery was, right? I know it sounds crazy, but it happens more often than you like it to be, right? Next thing to ask is, what was the size of the tear? Are we dealing with a small tear? Is this a medium? Is this a large? Were there multiple tendons involved, right? Is this a massive tear? Also, is there any concomitant pathology, right? Some folks will come in, they'll say, yep, I had a rotator cuff repair. And you'll ask, was there anything else that was going on with the surgery? And they'll say, nope. And then you go speak with the physician and they're like, oh, yeah, we did a biceps tenodesis with that, which essentially means you can't be doing a whole lot of direct bicep work early on. So I think it's very important that we just know exactly what we're dealing with, right? What type of surgery? Was there any concomitant pathology? Am I dealing with a labral repair in there as well, right? We need to know that because you might have to be careful because of the rotator cuff, but you might also have to be careful because of something else they did surgically, right? Another good question is, what is that tissue quality like? Was there any retraction of the tendon? How large was the space between the tendon and the bone? So they can actually tell you how much retraction there was. It could be slightly retracted or big time retracted, right? If you have a lot of retraction and that tendon quality, tissue quality is really poor, it's actually pretty tough to pull that tendon back and reattach to the bone. And it's probably a little bit more likely to re-tear over the course of time for that reason. I always ask for a protocol, right? So essentially, what does the surgeon want me to do? What do they not want me to do? And I want to make sure over the course of time I'm not overstepping their boundaries, right? Every once in a while, you get like a absolutely crazy protocol that doesn't make a lot of sense, and you think that it's maybe doing a disservice to the patient, right? And you can reach out to the doctor and just say, "Hey, I'm seeing this on the protocol. Is this something that you firmly believe in?" Because sometimes what happens is that a patient will be sent to your office with a protocol, and the protocol is just essentially taken from Google. It's not actually from that surgeon. So I would say reach out to the surgeons if you aren't already. Try to establish a relationship. See if they actually, believe in the protocol they're giving to their patients. Because if you're an informed physical therapist and you are concerned that someone is maybe going to get a little too stiff if we wait too long, right? Maybe the doctor is mega conservative for a small partial thickness tear, and you want to get them going a little bit sooner. Just reach out to the doctor. Make sure you communicate these things. I would not go over their head, right? We are in a litigious society. If this does re-tear and the patient comes back and puts the blame on you because you started active range of motion at week 4 and the doctor said don't do it until week 6, right? I know that stinks, but you have to be very careful and cover your butt, basically. If you guys are liking what you're listening to right now and you want to continue with the rolling, I have another video for you. It's called When Do Rotator Cuff Repairs Fail? So unfortunately, a chunk of these rotator cuff repair surgeries will fail, right? And it's important as physical therapists to know when these are actually occurring so we can be a little bit more cautious during this time period. So I'll leave a link above my head and go ahead and learn a little bit more about when rotator cuff repairs fail after surgery. Lastly, I just want to say thank you so much for your support. You truly allow me to do what I love for a living. If you're watching this on YouTube, hit that like button, leave a comment for me. I'd love to hear your thoughts on this, and subscribe to the channel. It helps me out tremendously. If you are listening or viewing the podcast version of this, please leave me a positive rating and review. Helps out tremendously, allows me to continue doing what I love to do and helping you guys out in the process. If you want to go that extra step in supporting me, consider subscribing to Insiders. What's Insiders? It's a comprehensive educational resource and toolkit for the fitness and rehab professional. All this content is produced by me. Think Netflix, but for trainers and physical therapists. It's premium content similar to this podcast, but more in depth. If you really like what you're learning from Fitness Pain Free, this is that next step to go deeper with your learning. I've been updating it monthly for the past 5 years or so. There's a tremendous amount of information in there. You've got over 100 webinars, ebooks, and complete guides. You have access to a private Facebook group where you can have all of your questions answered by me. You can decide upcoming podcast episodes. It's cheap to get started. There's a $1 1-week trial. Afterwards, it's just $10 a month. And lastly, you can cancel anytime. So if you want to get started, I'll leave a link in the show notes, or you can head over to fitnesspainfree.com, click on the programs link, and then click on Fitness Pain Free Insiders online library to get going. Lastly, if you want to check out any of the references, I'm going to leave those in the show notes as well. You can see exactly where I'm getting this information from.